actually the commercial name for botulinum toxin, and it is used for wrinkles on the face, especially the wrinkles that come on animation. So like you have frown lines, you have smile lines, or you have bunny lines, those are treated by Botox. Also perioral lines we treat with Botox, especially in smokers. And if you want to raise the eyebrow, if it is mild or moderate droopy of the eyebrows, then we can do that with Botox. So these are very fine injections that can be done in the clinic itself, and you can resume your normal activities immediately. Usually the Botox effect is seen 2 to 5 days after the injection, and it lasts for about 3 to 4 months. These are very fine injections, they are painless, and they can be safely done in the outpatient department. So blepharoplasty is a surgery which is done for hooded eyelids. Like some people have extra skin fold on the upper eyelid, and that literally covers the upper half of the eyelid and the eye visual field. Some of them cannot see up and out because of the fold of skin. That is treated by blepharoplasty. In the lower eyelids, many people have fat prolapse, so they call it lower lid bags. For those bags and loose skin on the lower eyelid, that can cause watering, that can cause various issues functionally also, in addition to cosmetic problem, and that can be treated by blepharoplasty. So this is a surgery which is done under local anesthesia. It is a daycare procedure. You can resume your normal activities even next day. You will just have some bruising, swelling for a week, and you will be fine after that. You will have a very rested and rejuvenated appearance of the eye after blepharoplasty. So dermal fillers are basically injections that we give on the face, and most commonly we use hyaluronic acid for fillers. This is a normal component of our joints, so it is very nicely integrated on the face. We get a whole range of products depending on their viscosity, depending on which site we are going to inject and the depth of injection. We can virtually contour the entire face with fillers. You can redistribute the volume on the face. Like if you want a nice prominent cheekbone projection, or if you want a good jawline, you want a good chin projection, all that can be done by dermal fillers. Many a times we use a combination of fillers and Botox to cause a complete facial rejuvenation. You can also plumb your lips, you can treat the hollows on the forehead, on the temples. Various options are available, and the best part of these injections is these are reversible. So if you are not happy with a certain area of injection, you can even reverse it with the antidote that is available. These are also done in the outpatient department. You don't need admissions for this. You can do your filler, you will see the effect immediately after the filler. The only problem that we can see is sometimes you can have some bruising in that area. So you do not plan a social event immediately after a filler injection. Again, brow lift is done for droopy brows. If you have a drooping of the eyebrow, we usually see more drooping on the outer side of the eyebrow, and this can be corrected either by injections, that is Botox, or by surgery. So Botox is used usually if you have very mild or moderate drooping, but if you have severe drooping, you will need surgery. The surgery is again done under local anesthesia, and it is a daycare procedure. We can do the surgery in various ways. So if you have a very thick eyebrow, we can make an incision just above the eyebrow so that the brow hair will hide the incision and won't be seen. If you have very thick forehead lines, we may use those lines to do the brow lift surgery. That will also shorten your forehead. We may use incisions just in front of the hairline, which again will be hidden. And what I like to use is small incisions behind the hairline to lift the eyebrow so that you don't have any visible scar on the face.